Hello, my name is Victoria Elias, and this is video number 4 in regards to chapter 20 that examines the peripheral, vascular, and lymphatic systems. To begin with this assessment, we're going to do the inspection and palpation steps of the arms. We're going to inspect the color, the temperature, capillary refill of the fingernails. It should be less than 2 seconds. The texture and the turgor of the arms in general. It should be less than 2. Arms should be symmetric in size, and we can examine what is called a profile sign. We're going to look at the fingernail from a side point. The curve of the nail should be less than 160. It should not be more than 160. The normal is 160 degrees. Abnormal findings that we can find during assessing this system could be a clubbing, which is more than 160 degrees of the nail bed. Lesions or an edema that it could be present in any redness, erythema, changes in temperature. The clubbing indicates acute endocarditis or cor pulmonale. To palpate, we're going to palpate the pulses. We're going to palpate the radial pulse, which is located over here, or we can palpate the brachial in case that we don't feel the radial too strong. There's an order to rate and document the pulse rate, and it goes from 0 to +4. 0 means that it's an absent pulse, +1 is a weak or steady pulse that indicates that the person might be experiencing shock or peripheral arterial disease. +2 is a normal, considered normal pulse. +3 is considered an increased pulse. It might indicate the patient is going through anemia or hyperthyroidism. +4 it's called a bounding pulse, and it could be found in patients with hyperkinetic states such as fever, exercise, or pain. We're going to check for the epitrochlear lymph node, which is located over here on the inner side of the elbow joint. We're going to do this by shaking hands with the patient, and if the patient experiences some discomfort or tenderness upon doing this motion, then it is positive. We could do another test that's called Allen's test, and that test evaluates the adequacy of collateral circulation of the hand. To test for this, we're going to ask the patient to extend their arms in a supine motion. We're going to do one at a time. We're going to ask the person to close a fist, and we're going to press with both thumbs, one in the radial artery and one in the ulnar artery, for about 2 to 5 seconds. And we're going to ask the person to open the fist. And then you should see the blanching, and as you release, you should see the refill of the capillaries as it turns pink again. For the legs, we're going to inspect for temperature, color, hairiness. The hairiness is very important in the area from the knee down, because it evaluates for the arterial efficiency of the legs. The size should be also important. It should be proportionate. Both should be the same. We can also do a test called Homan sign to test for the presence of clot. And when inspecting, we can also do what is called a Homan sign. For that, we're going to assess the presence of clots on the lower leg. We're going to ask the person to elevate the leg for us. We're going to sustain the leg at the popliteal fossa, and we're going to place the other hand at the plantar part of the feet. We're going to press them to place towards the patient, and if they feel a pain that runs all along the calf, then the test is positive. If not, then it is negative. We do this bilaterally, and we assess one at a time. We should not expect any lesions or any edema, any coolness, any blanching of the skin upon we're assessing. We also have, the same as for the pulse, we also have a way of documenting the level of edema in the case that is present. For that, it goes from +1 to +4, or it also it also has a 0 number, which indicates that there's no edema present. +1, it's a slight indentation, very slight indentation as we press on the area that has the edema. For example, let's say she has it here. If there's a slight indentation and it remains a little bit, then it's a +1. A +2 will be a little bit more indentation that remains a little bit longer, but no more than 3 seconds. For a +3, it remains a little bit about 2 to 3 seconds down after we release the pressure. A +4 indicates a very, very deep edema that remains for longer than 3 or 5 seconds. When assessing the lower legs, we're also going to palpate for the pulses located at the popliteal fossa below, behind the knee. We're also going to palpate the dorsalis pedis, which is located at the top of the dorsum of the feet. We also have the posterior tibialis, which is located on the side of the ankle, right between it's lateral to the Achilles tendon. And we can also palpate the inguinal femoral, which is located over here, right on the spot here between the iliac crest and the beginning of the head of the finger. That completes the assessment for chapter 20 for reading number 4.